My name is Bobby Tolbert. I'm a board member for Vocal New York. And today I'm going to talk to you about the impact of drug policy on actual drug users and people with HIV. But first I want to give you a little personal story about myself. I've used drugs for 40 years, and I'm pretty fortunate that I didn't die because of overdose or illness or experienced any long-term incarceration. Sometimes I had survivor's guilt because I've lost a lot of friends to overdose and HIV. Because in my generation, we didn't have syringe exchange or harm reduction services to guide us through our use. People wanted to take care of their health, but back then we didn't have the tools to do so. Our idea of harm reduction was cleaning syringes with water and bleach and sharing them with our friends. So as a result, I was diagnosed with HIV in 1995, and I made a decision that I wanted to live, and I made sure the things that I did in my life were according to the way I felt about life in general. Certain things had to be eliminated, and certain things had to be added on. As a result, I reduced my drug use, and I added on other medications that would sustain my life and give me the will and desire to help others to achieve the same kind of progress that I have. As a result, I joined the Vocal New York Users Union, and the reason was because they are about building political power among low-income people who use drugs to win improvements in our lives. In the United States, drug users are stigmatized and treated like pariahs rather than citizens, especially if you're Black, Latino, and/or poor. Vocal New York helps drug users organize to become viable parts of society, communities, and the political process. We organize drug users in syringe exchange programs, methadone clinics, homeless shelters, drug treatment programs, through peer-to-peer outreach around concrete issues that we know our community cares about. We use a range of tactics, from lobbying to media to even civil disobedience. For example, I was just reinstated to being allowed to come into the Capitol area because we disrupted a House of Representatives debate that would cause massive cuts to health care for the poor. So I'm just recently reinstated back into this area, so thank God. Drug user organizing also helps fight the stigma because we speak on our behalf and we build power that gives us a seat at the table. To give you an example of some of the things that we've done, I want to highlight methadone, hepatitis C, and overdose real quick. With overdose, we, in conjunction with the Drug Policy Alliance, helped pass a 911 Good Samaritan law and to encourage people to call an ambulance if someone overdoses without being afraid of going to jail. Since the law took effect, users have been meeting with government officials and agencies to make sure that the word gets out. In other words, we needed an endorsement from a high-profile player. We've also gotten naloxone into the New York City shelter system, where overdose is a leading cause of death. This past year, we focused on empowering patients in methadone programs and getting better access to treatment for hepatitis C, which is now the leading killer of people in methadone programs. But I want to focus on the drug war, or the drug unwar, syringe exchanges, and HIV prevention for this presentation. In the U.S., we have criminalized drug use rather than treating it as a health issue. But the day-to-day drug war is mostly carried out in poor communities of color. It's a war where it feels like we are the only casualties. The drug war is a major reason why there are more Black people behind bars under the supervision of the criminal justice system than were enslaved in this country in 1850, and that's a fact. 1 in 3 young black men are under the control of the criminal justice system, whether incarcerated, on probation, or on parole. Many are branded as felons for the rest of their lives. For example, in Chicago, more than half of the black men that have been convicted of a felony, and this allows them to be legally discriminated against for the rest of their lives. In a very direct way, the drug war criminalizes forms of HIV prevention, like syringe exchange and safe injection facilities, and it makes it hard to get methadone as a substitution therapy. It makes it harder for people to access treatment and health care that can save their lives. More broadly, the drug war breaks apart families and communities by locking up so many people. The consequences include legalized discrimination, which I spoke of, in housing, in employment, and education and welfare. We know that many of the problems related to drug use don't necessarily come from the drug use itself, but from society's reaction and response to it, or because of the other issues like poverty and homelessness. One concrete example of how the drug war fuels HIV prevention is harassment of users for carrying syringes. Local New York led a successful campaign to change the criminal code for the first time since the virus the epidemic started, to allow possession of new and used syringes, which became a state law in 2010. However, police continue to harass drug users for carrying syringes, and that fear makes it less likely that people will use clean works. This directly undermines HIV prevention efforts. Despite being one of the most heavily researched and proven HIV prevention interventions, the federal government once again bans the federal funding for syringe exchange, and many states and cities criminalize it in one way or another. Excuse me. To be clear, syringe exchange was begun by users for users. It was something that we forced the government to legalize and support. And the best models for syringe distribution in the United States today are using our own networks to distribute syringes throughout secondary and through secondary exchange called PDSE, or peer-delivered syringe exchange. Today in New York, almost 9 in 10 new HIV infections among those who inject drugs are among blacks and Latinos. Moreover, drug users have highest death rate among people living with HIV and AIDS. A major problem in New York has been the arrest and police harassment for syringe possession. People are afraid to carry new syringes because they don't want the police to lock them up if they find syringes during a stop and frisk, which is another tactic that is used by the NYPD. People of color and poor people are constantly threatened by the New York City Police Department. That being said, syringe exchange has been enormously successful in New York. For example, one study found that syringe exchange reduced HIV prevalence among people who inject drugs from 54% in 1990 to 13% 10 years later in 2001. So we know it works. Vocal did a user-led participatory research report called Stuck in the System, which is available online if you go to our website. And we interviewed nearly 100 people who injected drugs and found out that 7 in 10 respondents had been arrested for syringe possession, even though it's supposed to be legal. And in New York, nearly all of them had documentation from a syringe exchange program. 1 in 3 said they stopped going to SCPs or went less often as a result of being arrested. Members of the Users Union met with, before I say that, I want to just illustrate how impactful this has been. I'm going to give you a couple of quotes from some of the interviewees that we turned out. One said this: "I found that I don't carry any syringes on me. I try not to anymore. If I need a fix, I would either have to take a chance of cleaning another pair with bleach that belongs to somebody other than myself. I know that I can get them for free, but I know I have a handicap because when I get them, I can't use them. If the police are going to strip me of my clean syringes and throw them away, then now I'm back where I started from. Now I'm taking a risk using older ones, or I'm cleaning someone else's older ones. Another quote said, they start making jokes. I'm talking about the police department. This is a waste of time. All you're doing is making more junkies out here, that you should be embarrassed. So they put me in handcuffs and they started taking needles out of my, and putting them all over the place. And then they started asking me for right IDs and everything. I had my volunteer ID for a SEP out there clearly. They said if he's got syringes, he's going to be using. They kept on with their smart remarks and that I should be ashamed of myself. This is the kind of stigma that is thrown over users who are trying to conduct harm reduction in their lives. If the police go to SEP or a methadone clinic, they know there are individuals carrying syringes. So if they want to make an arrest or a quick bust, what are they going to do? Are they targeting people? Yes, they are. Members of the Users Union met with New York State legislators and senior staff from the governor's office to develop a proposal to fully legalize syringe possession, including used syringes with residue. This led to the passage of the Syringe Access Law in 2010. Since the law has passed, we've been monitoring implementation, because that's always a problem. We can get the bill passed, but they don't always implement it correctly. And trying to use this new law to change the relationship between people who inject drugs and the police, including getting the police to recognize that we are taking responsibility for our health when we use new syringes and safely dispose of old ones. But ultimately, as long as we criminalize drug use, we're going to still be targeting our communities for arrest. Now, we have lots of statistics about what works when it comes to HIV prevention among drug users. What we don't always have is the power to make it happen, to force politicians and the police to treat us as human beings. So for us, in closing, the solution to the drug war is to treat drug use as a health issue, not a criminal issue. We believe in ending drug prohibition, making drugs legal, but safe. We also believe in a broader economic and social justice that will allow poor people who use drugs to live their lives in dignity. I thank you for your time.